Hello, and welcome to the Center of Excellence for Behavioral Health and Nursing Facilities podcast. I'm your host, Rakia Campbell. In each episode of this quarterly podcast, we hope to uplift those who make a profound difference in the lives of others every single day. So today, we welcome our special guest, Naisha Frey. Naisha is the CEO of Naisha Frey Consulting. She has over 20 years of experience as a social behavioral researcher focused on substance use disorders, criminal justice, HIV and AIDS patient-provider communication, cancer, and more. A native of North Carolina, she has a Bachelor of Science degree in psychology from Florida A&M University, a Master's of Arts degree in clinical psychology from Teachers College at Columbia University, and a Master in Public Health degree in health behavior from the University of North Carolina, Chapel Hill. Welcome, Naisha, and thank you for joining me today.
Thank you so much, Rakia. I'm so glad to be here.
So today we're going to shine a spotlight on the vital issue of behavioral health equity. We'll explore how behavioral health equity is not just a concept, but a guiding principle within long-term care facilities. From ensuring fair access to mental health resources to addressing systemic barriers that impact vulnerable populations, let's unpack the strategies around this concept that's driving change within the walls of nursing facilities. So let's begin by asking Naisha, what is behavioral health equity?
That is the most crucial question, right? Just to even get into this discussion. Behavioral health equity is the right of all individuals, regardless of race, age, ethnicity, gender, disability, socioeconomic status, sexual orientation, any other demographic factor, to receive treatment and support for their mental health and substance use needs. Sadly, many people in need have mental health or substance use challenges and issues, but not enough of them are getting the help they need. This makes it hard for us to make sure everyone gets fair treatment for their mental health.
Mm. So what actually contributes to behavioral health inequities?
So there's not usually just one thing that hinders individuals from accessing the care and support they need. There are structural barriers such as financial constraints and lack of transportation, which can prevent individuals from seeking mental health care, particularly in areas with limited resources. Additionally, a lack of awareness about available services and how to access them further exacerbates these disparities. Furthermore, the stigma is big and looming surrounding behavioral health challenges, and it acts as a deterrent. It's a significant deterrent, both internally for the individual and externally. So individually, people may experience self-stigma, doubting whether they deserve or will benefit from mental health services. Externally, community stigma perpetuates negative attitudes and discrimination towards those seeking help. So, to address these barriers, initiatives are needed to increase awareness, reduce stigma, and improve access to culturally competent mental health and substance use treatment.
So you've mentioned everything as far as barriers from transportation to a lack of awareness about available services to self-stigma and even community stigma as barriers that some people are facing. So how can we best prepare nursing facility teams to address some of these issues?
Right. So, nursing facilities are in our community just like everybody else, so we have to take the time to prepare our nursing facility teams to address behavioral health issues. It's crucial to leverage available resources and prioritize ongoing education and adaptation. So the Center of Excellence for Behavioral Health in Nursing Facilities offers a wealth of resources. So please jot this down: nursinghomebehavioralhealth.org. Nursing facility leaders should proactively encourage their colleagues and teams to engage with these resources regularly. By investing in staff training and awareness, nursing facilities can enhance resident care and foster a more inclusive and supportive environment for all. Additionally, nursing facility leaders can collaborate with staff and residents to tailor these best practices to fit the facility's unique culture and workflow.
So since behavioral health essentially is the combination of both substance use and mental health, as you mentioned, traditionally this concept is stigmatized. So can you shed some light on why that continues to happen?
Yeah, Many people in our society have been socialized to believe that individuals with mental health conditions are crazy or dangerous. Similarly, substance use disorders are frequently viewed as moral failings rather than treatable health conditions. That perpetuates blame and judgment towards those affected. So, this stigma has profound consequences, including barriers to treatment, social isolation, and discrimination. People with behavioral health conditions may face reluctance to seek help, limited access to supportive resources, and systemic discrimination in areas such as employment, housing, and healthcare. Addiction and mental illness are chronic brain diseases, comparable to diabetes affecting the pancreas or heart disease impacting the heart. Seeking treatment is crucial for both mental health and substance use conditions. It's important to prioritize behavioral health care and actively end the stigma surrounding these conditions. By fostering empathy, providing education, and creating supportive communities, we can work towards reducing stigma and ensuring that all individuals receive the care and support they deserve.
In addition to challenging misconceptions and promoting understanding and advocacy, what are some other things that we can do to minimize behavioral health stigmas in nursing facilities? Are there any other things that we can do?
Yeah. I think it's great when we can engage in open and honest conversations about behavioral health, just like we're doing now. I encourage nursing facility leaders to have these conversations with their staff and to discuss these things so that we can get some of those misconceptions out in the open and start to change people's thinking and ways of seeing people that we're caring for. It's important when we're doing that to seek out credible information and promote understanding and empathy towards individuals with behavioral health conditions. It's also important to use appropriate language when discussing mental health and substance use. This can help eliminate stigmatizing language, which can result in unintended consequences if overheard or heard directly by someone facing behavioral health conditions. So, by utilizing the Center of Excellence for your training needs and accessing educational material relevant to nursing facilities, you can eliminate some of the time and effort involved in pulling those materials together. The work has already been done for you. And so you know that it's coming from a really good source with accurate information. Also, sharing success stories of recovery and resilience can provide hope and inspiration to those living with behavioral health conditions and their caregivers. By highlighting positive outcomes and celebrating progress, we can challenge stereotypes and foster a culture of support, understanding, and healing.
So you mentioned something interesting. You talked about community partnerships. I think that's probably something that maybe some nursing facilities don't even think of. So how do nursing facilities benefit from establishing and cultivating behavioral health community partnerships?
So, by forming partnerships with community organizations, nursing facilities can expand their capacity, fill gaps in care, and enhance the overall well being of their residents. For example, partnering with local mental health clinics can provide residents with access to on site counseling services, while collaborating with community organizations can offer support groups for both residents and caregivers. Additionally, working with cultural competency training programs ensures that care is culturally appropriate and sensitive to residents' backgrounds and preferences.
Great. So in summary, as we close out this episode, what are some key things facilities can do today to drive behavioral health equity in their facilities? Anywhere from kind of 3 to 5 key points you want folks to leave with.
Yes, so this is a really important one. Number one, make sure you visit the website and utilize the resources at the Center of Excellence for Behavioral Health and Nursing Facilities. Remember to lead your organization, your colleagues, your teams in discussions about behavioral health care, and also start to come up with some ways that you can routinely assess the behavioral health needs of your patient population, making these conversations routine and normalized for everyone. The other thing that I would stress is to make sure that we are leading with empathy, when we care for people with behavioral health needs, and that we're very careful with our language so that we are not creating more stigma in the way that we communicate unintentionally. And then the last thing is I encourage people to reach out to your community partners, learn more about the organizations in your community and what they can possibly do to support the behavioral health needs of your residents in your care.
Awesome. Well, thank you so much, Naisha, for joining me today. And thank you, everyone, for tuning into this episode of the Center of Excellence for Behavioral Health in Nursing Facilities podcast. We'll see you next time.